According to a recent study from Tufts University, more than 60% of people over the age of 60 in the United States are living with at least one heart-related condition, yet nearly 35% of them do not realize that a hidden cause could be the very vegetables they eat every day. You may have been very careful, cutting back on sugar, avoiding greasy foods, staying away from processed meals, and still, your heart races, your blood pressure rises and falls, your body feels tired for no clear reason. At that moment, you might ask yourself, I eat vegetables every day, why is my health not improving? The answer could lie in certain vegetables that seem healthy but may actually trigger irregular heartbeats, raise your blood pressure, or even interfere with heart medications, especially if they are not used the right way. In today's talk, I want to share with you 5 vegetables that seniors over 60 should be extremely cautious about. Please do not skip this. One of these might be sitting on your dinner plate right now. What state do you live in, and how old are you? Leave a comment below. I always listen so I can better understand you. 1. Celery for younger people. Celery is almost harmless. In fact, it is often seen as a superfood, but for those over the age of 60, especially individuals taking heart medications, it can be a vegetable that triggers irregular heart rhythms, causes unstable blood pressure, and leaves the body feeling more fatigued each day. In every 100 grams of celery, there are about 80 milligrams of sodium, 260 milligrams of potassium, and nearly 1.6 grams of fiber. These are all nutrients that support heart and blood pressure health when used in proper amounts. However, the problem lies in how we consume it, and for older adults, the body no longer reacts the same way it once did. You may have heard that celery juice helps cleanse the liver, flush out toxins, and support blood pressure. But in reality, if you drink it daily, without monitoring the amount, and while also taking diuretics or blood pressure medications, you may be putting your heart under a dangerous strain. The potassium in celery can raise blood potassium levels and lead to electrolyte imbalances. This can cause a rapid heartbeat, a feeling of restlessness, fatigue, or even sudden drops in blood pressure that may result in dizziness, falling when standing up, or trouble sleeping at night. As kidney function tends to decline with age, too much potassium from raw juice like celery can overwhelm the kidneys. When the kidneys cannot remove it quickly enough, the heart must work harder to regulate blood pressure. A report from the American Journal of Clinical Nutrition found that older adults who drank celery juice daily had a 27% higher risk of blood pressure and potassium imbalance compared to those who ate cooked celery in moderate amounts. One of my 68-year-old patients from Michigan had already cut salt, ate bland foods, and walked every morning. Yet she constantly felt tired and lightheaded. After reviewing her diet, we found the cause was the glass of celery juice she had been drinking every morning for the past 3 months. She had no idea that celery could interact with blood pressure medications and silently disrupt heart function. What makes it dangerous is that there are often no clear warning signs until your heart's already exhausted. So should you completely eliminate celery? No. Celery is not bad, but it is not suitable to be consumed as raw juice on a daily basis for older adults. If you enjoy this vegetable, you can still use it in cooked soups, lightly steamed dishes, or quick stir-fries with olive oil. The important thing is to avoid drinking raw celery juice every day, especially if you are taking medications for heart conditions, blood pressure, or diabetes, and if you plan to make changes to your diet. Always inform your doctor so they can monitor your condition closely. After 60, your body does not need extreme detoxes. It only needs things that are gentle, stable, and just enough. 2. Pickled vegetables. Have you ever thought that just a few slices of pickled vegetables on your plate could make your heart beat harder than usual? For people over the age of 60, salt is not just a seasoning. It can become a burden on the blood vessels and the heart if not properly controlled. Pickled vegetables, also known as pickles in the American diet, are often seen as a simple side dish, but the truth is, 100 grams of pickles can contain more than 100 milligrams of sodium, which is about 70% of the recommended daily limit for older adults, and that is just from a few small pieces. When sodium enters the bloodstream, it causes the body to retain water. This increases the volume of blood, putting pressure on the vessel walls and forcing the heart to pump harder to circulate blood throughout the body. Younger individuals with stronger circulatory systems may be able to adapt. But after the age of 60, blood vessels lose elasticity and the heart has already been working for many years. Eating salty foods regularly is like adding extra weight to someone who is already tired. Mrs. Linda, age 71, living in Ohio, is a clear example. She had cut out fried foods, avoided red meat, and practiced gentle exercise every day, but her blood pressure remained unstable. At every doctor visit, her medication needed to be adjusted. When I asked more about her eating habits, she mentioned that she often ate bread with pickled vegetables and never imagined that such a small dish could be harmful. After stopping pickles for 2 weeks and replacing them with steamed vegetables and lightly salted greens, her blood pressure began to stabilize without increasing her medication. Mrs. Linda's story is not rare. Many older adults believe that just a few bites of pickles are harmless, but the damage from salt does not show up right away. It quietly harms blood vessels, causes inflammation, and thickens the artery walls. Then, one day, a stroke, chest pain, or swollen legs may appear suddenly, but in reality, the risk has been building up silently for months. According to a report from Harvard Health Publishing, older adults who regularly eat pickled vegetables have a 32% higher risk of chronic high blood pressure compared to those who limit sodium in their diet. Whether it is pickled cucumbers, fermented greens, or any salted preserved vegetable. Your body after 60 cannot remove sodium as quickly as it used to. The kidneys become less efficient, the heart must pump harder, and the brain is also affected when blood pressure swings up and down. So what is the safe solution? You do not need to give up every dish you love. If you enjoy that sour and salty flavor, you can try fresh vegetables mixed with apple cider vinegar, lemon juice, or dried herbs. If you still want to eat pickled vegetables, choose low sodium options, make your own at home, and limit the portion to a reasonable amount. Always read the labels carefully, because many store-bought pickles contain more salt than you think. Your heart should not have to fight every day over just a few slices of vegetables. It simply needs you to understand and make gentle, informed choices. 3. Red chili peppers. For many people, a meal feels incomplete without a bit of heat. Red chili peppers, whether fresh, in powder form, or as hot sauce, can enhance flavor, warm the body, and even improve mental alertness. But what few people realize is that red chili peppers may silently trigger irregular heart rhythms and sudden spikes in blood pressure, especially in those over 60. In every 100 grams of red chili, there are about 64 milligrams of vitamin C and a special compound called capsaicin, which is what creates the spicy sensation. When capsaicin enters the body, it stimulates the sympathetic nervous system, prompting the adrenal glands to release adrenaline. This causes the heart rate to rise, blood pressure to increase, and blood vessels to constrict quickly. In younger individuals, this may be a mild reaction that the body easily adapts to. But in older adults, where blood vessels have lost elasticity, the heart is weaker, and inflammation is more likely. This reaction can lead to serious consequences. A 67-year-old male patient named George from Arizona came into the clinic with a rapid heartbeat, dizziness, and a feeling of unexplained anxiety. He did not smoke, maintained a regular walking routine, and had been on blood pressure medication for years. After monitoring his heart rhythm and carefully reviewing his diet, we discovered that he added red chili sauce to nearly every meal, including his evening soup and morning boiled eggs. George had no idea that each spicy bite was strongly stimulating his heart. After cutting out spicy foods for just 1 week, his heart rate normalized and the feelings of restlessness completely disappeared. The elderly body reacts differently to capsaicin, not only because the heart is weaker, but also because the ability to self-regulate blood pressure has declined. Several studies show that frequent consumption of spicy foods can cause chronic low-grade inflammation in the blood vessels, making them more vulnerable to damage when blood pressure or cholesterol levels fluctuate. According to a report from Tufts University, older adults who eat spicy food more than 3 times a week have a 24% higher risk of irregular heartbeat compared to those who prefer mild seasonings. Furthermore, eating spicy food at night can disrupt sleep, causing a rapid heartbeat during the night and leading to sudden awakenings without a clear reason. So, without chili, can food still be tasty? The answer is absolutely yes. You can use ginger, cooked garlic, mild black pepper, fresh herbs like cilantro, green onions, or a splash of lemon juice to replace that sharp spiciness. These ingredients not only awaken the taste buds, but also support digestion and help keep the heart rate more stable. Delicious food does not have to overstimulate the heart. Listen to your body, because that feeling of unease after a meal may not come from emotion, but from the very spices you choose. But if a single chili pepper can raise your heart rate and blood pressure within minutes, there is another vegetable, often seen as a natural miracle, that can make your blood so thin it may cause internal bleeding if used the wrong way. 4. Raw garlic. Garlic has long been known as one of the most heart-friendly herbs. It is often said to help reduce cholesterol, lower blood pressure, and clean the arteries. This is not wrong, but it is not always true in every situation, especially for those over the age of 60 who are taking heart medications or blood thinners. Garlic contains a powerful active compound called allicin. This is what gives raw garlic its strong smell and also its blood-thinning effect. If you are taking medications such as aspirin, warfarin, or other anticoagulants, adding raw garlic to your daily routine can make your blood too thin, increasing the risk of internal bleeding and sudden drops in blood pressure. What is frightening is that you may not notice this until symptoms appear, such as persistent nosebleeds, rapid bruising, black stool, or unexplained dizziness. I still remember the case of Mrs. and Susan, 69 years old, from Seattle. She had been taking aspirin daily after a mild stroke 3 years ago. Trusting in the benefits of garlic, she began eating 1 clove of raw garlic every morning as a natural supplement. About a month later, she started having frequent bleeding from her gums even with gentle brushing, felt dizzy when changing positions, and once nearly fell due to a sudden drop in blood pressure. After a blood test and a detailed review of her diet, we discovered that the combination of aspirin and raw garlic had made her blood too thin, causing a series of dangerous symptoms she never suspected. Other patients have also reported rapid heartbeats, fatigue, or unusual drowsiness when combining raw garlic with blood pressure medications. Raw garlic in high doses not only thins the blood but can also lower blood pressure too quickly, leaving the heart with little time to adjust blood flow properly. A report from the Geriatric Pharmacology Research Center at McMaster University showed that adults over 65 who consumed raw garlic more than 4 times a week while on blood thinners had a 39% higher risk of bleeding compared to those who did not consume raw garlic regularly. Garlic is not the problem. What matters is how you use it and the amount you choose, based on your age and current health condition. So what is the safe solution? If you love the flavor of garlic, you can absolutely enjoy cooked garlic. Sautéing, roasting, or lightly steaming it helps reduce allicin activity while keeping its aroma and digestive benefits. And most importantly, always inform your doctor if you plan to include raw garlic as a regular part of your diet, especially if you are taking heart medications. After 60, every small choice affects the rhythm of your heart, your blood pressure, and your body's ability to recover. 5. Raw sprouts. Raw sprouts, also known as bean sprouts, alfalfa sprouts, or mung bean sprouts, are a common part of many American meals. They are often found in salads, vegetarian sandwiches, subs, or used as toppings for soups and ramen noodles. For many people, especially those interested in healthy eating, raw sprouts bring a sense of freshness, light crunch, and high nutrition. But the truth is, this is one of the vegetables with the highest risk of causing foodborne illness when eaten raw, especially for older adults with weakened immune systems. The risk lies in how they are grown. Sprouts are germinated from seeds in a warm and moist environment, with no sunlight and very little control over bacteria. These are the exact conditions that allow bacteria like E. coli, Listeria, and Salmonella to grow easily. When eaten raw, you are unknowingly introducing millions of live bacteria into your body without cooking them first. In young people, a healthy immune system can handle this, but after the age of 60, the immune defenses are lower and digestion is weaker. Even a small amount of bacteria can cause diarrhea, dehydration, or even blood infections if not treated promptly. Mrs. Carolyn, 74 years old from Portland, is a longtime vegetarian. She regularly used alfalfa sprouts in her lunch sandwiches and salads. One day she was hospitalized with a mild fever and persistent diarrhea. Doctors suspected a bacterial infection in the intestines. After reviewing her diet, she admitted that she ate raw sprouts every day and often did not wash them thoroughly. Tests showed she had a salmonella infection, which required antibiotic treatment and 4 days of IV fluids. Though she recovered, she said the lingering fatigue lasted for weeks, leaving her exhausted and unable to sleep well. According to data from the Centers for Disease Control and Prevention, CDC, the United States recorded at least 40 food poisoning outbreaks linked to raw sprouts in just 20 years, mostly affecting older adults, pregnant women, and people with chronic health conditions. The danger is that sprouts still look fresh and crunchy, but bacteria cannot be seen with the naked eye or detected by smell or taste. For people over 60, the consequences of eating contaminated raw vegetables are not just about diarrhea. They can lead to serious dehydration, low blood pressure, acute kidney failure, or balance problems due to exhaustion. So how can you enjoy the fresh taste of sprouts while avoiding the risk? The answer is simple. Always cook them fully before eating. You can blanch them quickly in boiling water, stir-fry them lightly with olive oil, or add them to soups, noodles, or fried rice. The cooking process will kill most harmful bacteria while still keeping the crunch and essential nutrients. You do not need to remove sprouts from your meals. You just need to prepare them properly to protect a body that becomes more sensitive with age. A small choice, a gentle habit change, can become a strong shield that protects your health every day. And now that you know that the 5 vegetables that seem healthy but carry hidden risks, you can feel more confident at the dining table and choose exactly what your body needs after age 60. After everything we have shared today, perhaps you are starting to see food from a different perspective. Not every vegetable is good for everybody, and eating healthy does not always mean suitable for someone over 60. We just went through 5 vegetables that seem harmless but can silently harm your heart, and overall health. Celery may disrupt blood pressure. Pickles can overwork the heart due to excess salt. Red chili peppers stimulate the heart and inflame blood vessels. Raw garlic thins the blood dangerously when combined with medications. And raw sprouts carry millions of invisible bacteria. No one wants to give up foods they once loved, but after age 60, your body changes every day. What was once good at 40 may now require more careful consideration. A small change today can bring long-term stability, and you do not need to change everything overnight. Just one small shift, like steaming sprouts instead of eating them raw, or swapping chili for a few slices of fresh ginger, can help your heart beat more gently, your sleep deepen, and one more worry quietly disappear in the middle of the night. If you found today's message helpful, please hit the subscribe button and turn on the notification bell so you never miss our next tip. We will continue to bring you simple, easy to understand, and practical guidance on foods, herbs, and gentle exercises to help those over 60 stay healthy in a natural and sustainable way. And what about you? Are you currently using any of the vegetables on this list? Have you experienced similar concerns? Leave a comment below. I read every message to better understand your health journey.